I was first diagnosed in April the 4th, 2018. And at that time, it really changed my life. And the only reason why I found out I was HIV positive is because I had two kidney failures and they couldn't understand why I kept going into failure. And what stands out most about that day is having my mom in the room with me and her wrapping her arms around me and letting me know that I was going to be okay and that I was going to survive. Since then, I have done different webinars. I first went public in 2019 at my church, and I was well received by my pastor and the members. Everyone continues to show me love. They never treated me any different. And I believe that it's important for us to speak out and be the voice for the voiceless. And I just love the community that has surrounded me. I've gained a new family since I became HIV positive. I've gained new friends. I've gained a new understanding of HIV because the first time I heard about it was when one of my cousins had passed away back in the 80s with HIV. And since then, I never really looked into it. But when it came personal to me, I knew that I had learned as much as I can.
Um, Hi guys, my name's Nicole. I'm the mother of two kids and two dogs. Um, I was diagnosed with HIV in August of 2013 and have been undetectable since January of 2014. So I'm just over 10 years undetectable. Yay! Um, so my story is basically my late husband took his life in March of 2012. He had borderline personality disorder. He was an alcoholic. He was also a sex addict. Shortly after he passed, I got sick with mono. I was sick for months and months, like all through the summer. Um, and that fall, I had shingles. Um, and in hindsight, if somebody that young, I was 40 at the time, has shingles, they should automatically be tested for HIV. I didn't know that. My primary care physician didn't know that. Could have been caught sooner, but um, the following summer I got thrush. And being that I research everything, I literally research everything. I was pretty sure that I had HIV before I even went to the doctor's office. When that test came back positive, when I did go in August of 2013, I was terrified. The only thing that I had knew about HIV was from Forrest Gump, and I'm sure many people can relate. Um, Growing up in the 80s and seeing Jenny in Jenny, right, in Forrest Gump, had got diagnosed with HIV and she died. And all I knew about HIV at the time was that people died from it. I thought my kids were going to be parentless. I was freaking out, to be honest. It took almost a month for me to get into a specialist, excuse me, the infectious disease doctor's office. And like I said, I researched. So before that appointment, because I was needed to calm myself down and figure out what was going to happen with my life and my kids and my family, I researched for practically 40 hours straight from my time of diagnosis to find out, in fact, that I was going to live and not only live, but live as long as probably anyone else that I know and live a healthy life. Once I got on medication, it was about 3 months until I was undetectable. I started medication in October, I think, and I was undetectable by January of 2014. So in the fall of 2017, the CDC acknowledged that HIV, if it was undetectable, it meant that it was untransmittable. Many of you have probably heard of the U equals U campaign that was started not by the CDC, but because of the CDC was admitting it, I decided to come out about my status. So I created a group on Facebook called This is HIV, disclosed my story. I had, of course, told my family before then. But when I did post that on social media, I worried about losing, how many friends are going to unfriend me? How many people are going to, how much hate mail or whatever am I going to get? Um, but the overwhelming positive response that I got from literally everyone, I didn't get any negative feedback at all. It was just absolutely amazing for me to experience that and not have literally had nobody saying anything bad to me. Through that group, this is HIV, through my Facebook group, I've spoken with hundreds of people from all parts of the world, mostly through Messenger. Um, a lot of the people I speak with are from third world countries, and many of them who are positive are banished from their community. They get beaten on a regular basis by people that know their status, and some of them were even killed just for their HIV status. And that just made me just reinforce how incredibly lucky we are to live in a country where we have access to help, to medication, and for the most part, we don't have to live in fear for our lives simply because we have a disease. My main objective through my Facebook page and the other the other places that I've been on a news story here and posted in the Novant Health um, weekly, or I think it's a monthly article. But my main objective is to educate people. My focus for education is twofold. One is getting people to know their status. You don't know if you have HIV because you think you don't. Um, so you can only know your status by getting tested. So getting tested is like number one on my objective. And statistically, this has changed. It was 1 out of 7 when I was diagnosed, but now it is 1 out of 6, at least the last stats I checked. 1 out of 6 people have HIV and they don't even know it. So go get tested. My second objective in education is to spread the word about U equals U, meaning undetectable equals untransmittable. People don't realize that once you're on medication, I mean, the general public doesn't realize that once you're on medication and you become undetectable, you cannot transmit HIV. This does require staying on your medication, getting tested every 6 months, but people don't realize that we're not. This will help end the stigma. People knowing that just because we have HIV doesn't mean that they're going to get it. So go get tested. And remember, just because someone has HIV doesn't mean they can give it to you, as long as they are undetectable, again, and follow their medication regimen. I do have my Facebook page. If you want any more information about my story or some statistics about HIV that you can read, you can visit my group on Facebook. It's called, you can find it if you hashtag "This is HIV." And you can see that here, I think. It's backwards, maybe. Hashtag "This is HIV." And I have the flower growing out of the V there because HIV is no longer a death sentence. We are growing and we are healthy like flowers in the spring. That's my story, and thanks for listening. When people look at me, you wouldn't think that I have HIV, not just because I don't look sick or anything, but I'm a white woman, and most the statistics show that we are pretty much, as white women, the lowest on the demographics that have HIV. That is growing. I mean, it's one of the faster growing populations, but being that it's one of the fewest, if that makes sense, I wanted to bring my perspective, I guess, to the group, and also learn more about what's happening to cure HIV. So I think between bringing my perspective and learning how to expand education by, our group volunteers for different things to educate the community. That's what drew me to the group. And I'm glad to be here.
Thank you. Latoya?
Yes, I joined because a previous member seen that I was doing a lot in the community, and she thought it would be a good opportunity for me to be on part of the CAB. And I enjoy meeting each and every one of you all. I enjoy telling my story because that means that the more I tell my story, the more people can understand the importance of getting tested. The one thing that I like about the CAB is the community involvement that you all have, and talking to different people and corroborating with other organizations. I think that's very important because in the area that I'm in, we don't have that at all. So with being on the CAB, I'm learning more information and I'm able to go out into my community and help everyone.
Thank you. And Tareen?
Yes. So I was attending a lot of online meetings within the HIV community, and I kept hearing noise and chatter about how women are not represented in research and how people need to get more involved in CABs and have input. But in my area, in the Chicagoland area, some of the CABs in the HIV communities are very political, like you can't get in if you're not in the clique, right? And it'd be people sitting on these boards in these positions for years and years and years. So I began to open my mouth and just began to ask and ask and ask. And like every year I'd knock, I was like, can I get in? Can I get in? It was like a secret club or a clique, right? And I mean, you have to tell me no 300 times. So then I told someone and they gave me like a national list. So I would reach out to each one of those groups. And I'm in Illinois. You guys are in North Carolina. So I emailed and Tanya responded and invited me in. So I think that, and then I'm able to give like a national perspective or different perspectives from different geographical areas and share different best practices. Because then several groups invited me in at once. I'm like, oh, wow. Well, for me, the choice was taken away from me. I think initially when I found out it was summer and my middle daughter was home from college. We were in the kitchen and my baby girl went outside to play baseball and somebody had put a note on my car indicating that my partner indicating my partner's status. So she comes in the kitchen. She says, "Ma, there's a note on your car," and she's standing there. I'm like, "Well, read the note, girl." Like, all my children are in the kitchen, and it indicated that their dad was positive, was HIV positive, right? And it was a shock to us. So I told the kids, "Oh, don't worry, go outside and play." After they went outside and played, my daughter from college said, "You better go get tested," right? And then once it was confirmed, um my part and I, you know how you have to go back and tell the people, your previous partners, they want you to go back 10, 20, 30 years and tell at that time to disclose to your previous partners. I did, and one of them threatened to tell my children.
Historically, any medical research has been done on males, and women have kind of been totally left out of the picture. Not kind of, we have totally been left out of the participating and or just left out of research in general. So I think being women involved in this helps get our voices heard, that research needs to be done in every aspect of science to include women. At the same time, I think, at least for myself and a few other board members, I'm sure, being over 50 and menopausal, between medication and having the virus initially, it's a whole other ballgame than men and the medication.
Because we're not seen, Most of the time, we're not heard. So it's important for us to get involved so that we'll have a voice for the voiceless also.
The medicine that they give white men does not work the same on my body. The medicine that they give white women does not work the same on my body. Even the medicine that they give Black men does not work the same on my body, right? So we have to be involved in the research on the front end of it so that we are participants in the study so that researchers can be made aware of this and see